Welcome to Bite-Sized Health, the podcast where we explore how small daily choices, especially the ones on your plate, can shape your long-term wellness. I'm Sabrina Cooper, a registered dental hygienist and culinary nutritionist and practical herbalist. And today we're going to be addressing an often overlooked topic: how the foods we eat affect both our oral health and our overall systemic health. From cavities to cardiovascular disease, from bleeding gums to brain fog, it turns out your mouth has a lot to say about what's happening in the rest of your body. We're about to uncover how food can hurt or heal you, starting not at the root of your tooth, but starting with your mouth. Let's start with a question. When was the last time your dentist asked you about your diet or heart health? Chances are probably never, because when you visit the dental office, usually the main goal is to have your teeth cleaned. But your mouth doesn't live in isolation from the rest of your body. So it's really important that your healthcare professionals should be asking you these questions. And if they're not, then you should be asking them why they're not asking you these questions. In fact, oral tissues are highly vascularized, meaning there's a direct highway from your gums into your bloodstream. So what happens in the mouth doesn't stay in just the mouth. This is the foundation of the oral systemic health connection. We have talked a lot on our other podcasts about the brain-gut connection, and this oral systemic connection is the growing understanding that gum disease, tooth decay, and oral infections can influence or even worsen systemic conditions like cardiovascular disease, type 2 diabetes, respiratory infections, rheumatoid arthritis, pregnancy complications, and even Alzheimer's disease. And so it's a two-way street. Systemic conditions, especially inflammatory and autoimmune ones, can manifest early in the mouth. That makes oral health a critical early warning system for overall health. Let's get into the role of food and understand food's direct impact on oral tissues. Every bite you take sets off a chain reaction in your saliva, on your enamel, in your gum tissue, and eventually in your blood. Let's break it down. Sugars and fermentable carbohydrates. These are public enemy number one for tooth decay. Why? Because oral bacteria like Streptococcus mutans feed on sugar and starches. They metabolize the carbs and produce lactic acid as a byproduct. That acid then demineralizes your enamel, starting the decay process. This isn't just candy or soda. Refined grains like white bread, crackers, granola bars all break down quickly into sugars that feed bacteria. Sticky and slow dissolving foods are even worse. They cling to teeth and prolong exposure to acid. And then we have the acidic foods and drinks. Think lemon water, kombucha, citrus fruits, energy drinks, vinegar-based dressings. I'm not saying we can't eat these, but frequent consumption of acidic foods lowers the pH in the mouth, weakens enamel, and leads to erosion. A different but equally harmful process than decay. Sipping acidic drinks slowly throughout the day is particularly damaging. It's like giving your teeth an acid bath in slow motion. It doesn't mean you can't enjoy these again, but there are ways to protect your teeth that we'll get into a little later. Have you ever thought of frequency of eating? And what I mean is, it's not just what you eat, but how often. Every time you eat or take a bite, you lower the pH in your mouth, and it takes about 30 to 60 minutes for saliva to neutralize the acid. So if you snack all day without addressing that your pH is lowered, your mouth never gets a chance to recover. You might be wondering how we get it more balanced. Don't worry, I'll let you in on some tips after we get through all the important stuff. One of the most dangerous oral conditions in your oral health is chronic gum inflammation, also known as periodontitis. It starts as gingivitis, red, swollen gums that bleed when brushing. But when ignored, it progresses into the destruction of supporting structures of teeth. Now here's the systemic link. The bacteria involved in gum disease don't just stay in your mouth. They travel into your bloodstream, where they trigger systemic inflammation. This chronic inflammation is a silent contributor to arterial plaque formation, insulin resistance, joint deterioration, and possibly neurodegenerative changes in the brain. What's the dietary link, you ask? A pro-inflammatory diet, high in ultra-processed foods, sugar, and omega-6 seed oils feeds this inflammatory cascade. On the other hand, an anti-inflammatory diet can help reverse the damage, and we'll get into those foods in just a moment. So what are the nutrients that strengthen the mouth and body? Let's talk about nutrition, because food can harm, but it can also heal. I'm going to give you the most important mouth-friendly and body-protective nutrients. 1. Calcium and vitamin D. Calcium builds strong teeth and bones, while vitamin D helps your body absorb and use that calcium. Deficiencies in either can lead to weakened enamel, bone loss, and tooth mobility. Some great sources are dairy products, leafy greens, almonds, fortified plant milks, egg yolks, and sunlight exposure, of course. Number 2, phosphorus. This works hand in hand with calcium, crucial for the remineralization of enamel. Found in meat products, fish, legumes, and nuts and seeds. Number 3, vitamin C, vital for collagen production and gum tissue integrity. A deficiency can lead to swollen, bleeding gums, which I am really talking about extreme cases that is persistent. However, vitamin C will keep inflammation and the bleeding gums in check by consuming foods from the following sources: bell peppers, oranges, kiwis, broccoli, strawberries are just a few. Omega-3 fatty acids is number 4. Powerful anti-inflammatories that help reduce gum inflammation and systemic inflammation. Some of the items that you can find this in are fatty fish like salmon and sardines, chia seeds, flax seeds, walnuts. Number 5, polyphenols and antioxidants. These protect the gum tissue, neutralize bacteria, and support the oral microbiome. And these are found in green tea, berries, and dark chocolate, yay, red grapes, herbs, and spices. But again, just be careful with the dark chocolate. It's not as high in sugar, but you also just want to be really careful when consuming that and rinsing with some water perhaps after you eat that chocolate. Fiber helps regulate blood sugar, feed beneficial gut and oral bacteria, and stimulate saliva production through chewing. You can find fiber in vegetables like celery, leafy greens, and broccoli, legumes, beans, and chickpeas, whole grains such as brown rice, quinoa, millet, buckwheat, and of course in nuts. Then there's a few others, of course, that you can find some fiber in. You're not limited to some of these options, so please, do your due diligence and your homework. I'm just giving you a few little ideas of where to find some of these great food items to incorporate into your regular routines. Your mouth is home to a complex ecosystem of bacteria known as the oral microbiome. When in balance, these microbes help digest carbs, prevent overgrowth of harmful bacteria, keep pH in check, and support your immune system. But a poor diet, low in nutrients and high sugar, leads to oral dysbiosis. This imbalance allows plaque-forming acid-producing bacteria to thrive. Probiotics like yogurt, kefir, sauerkraut, and fermented vegetables may help reintroduce beneficial strains. Research is still emerging in this area, and I know Dabney has touched on this topic in a previous podcast, so just check it out for more information. And also important is saliva. Saliva neutralizes acid, carries minerals like calcium and phosphate, and acts as your first line of defense. Chewing crunchy fibrous foods helps boost saliva production. So does chewing sugar-free gum with xylitol, which also reduces cavity-causing bacteria. So, as promised, here are some practical tips and dietary habits that we will wrap up with, and it comes with actionable advice. Foods to limit: sugar-sweetened beverages, sticky candies, ultra-processed snacks, white bread, pastries, and refined carbs. Also, frequent grazing or sipping all day. That's not a food to limit, but that's something you shouldn't be doing. And excess citrus or vinegar without rinsing afterward. Some of the foods to embrace, however, are crunchy raw vegetables like carrots and celery, leafy greens, nuts and seeds, green tea, high-quality protein from meat, eggs, or legumes, low-sugar, dairy, or plant-based alternatives, water, and lots of it, and timing matters. So try to limit snacks between meals. This will address your frequency of eating. Drink water after meals to cleanse the mouth, to remove unwanted food that sits on your teeth, and will help balance your pH and create a less acidic environment for bacteria strains to thrive. And if you do indulge in acidic or sugary foods, try to consume them in one sitting. Don't stretch it out over a long period of time. Eat the items in a shorter period of time instead of nibbling, sipping, or snacking over this long period. Also, I just should mention, your hygienist is not wrong when she's always asking about flossing, interdental aids, brushing your teeth, rinsing. These are all really important things to incorporate into your regular routine to move the microbiome, the plaque that's sitting on your teeth. This is all really, really important and vital, and we really love that you incorporate these into your everyday routines so that your health of your mouth is on point, and then you won't have to worry so much about all the other things because you're removing everything that's in between, and the bacteria doesn't have a chance to do its thing and multiply. So really focus on that as well. So here is what it all comes down to. Your mouth is more than a place to chew. It's an early warning system, a microbiome hub, and a critical player in your immune system. The foods you choose can build resilience or chip away at it, one bite at a time. By nourishing your oral health, you're supporting your heart, your brain, your blood sugar, and so much more. So next time you reach for a snack, ask not just, is this good for my body, but also, is this good for my mouth? Thanks for listening in on Bite-Sized Health. And if you learned something today, share this episode, follow the podcast, and tune in next time as we explore more of the everyday habits that shape your long-term health. Until then, keep smiling, chew wisely, and be well.